an honor to present on behalf of the beta blockers in heart failure collaboration our data on patients with renal dysfunction. So the beta blocker collaboration is a worldwide effort to try to improve the care and management of patients with heart failure. In this analysis we look specifically at those with reduced ejection fraction, and we try to tease out the outcomes and the benefit from beta blockers in patients particularly with moderate and moderately severe renal dysfunction. Now, why are we doing that? Well, we know in clinical practice that a lot of our patients have impairment of their kidney function. In fact, it's often the norm in our patients, and yet quite a lot of the randomized trial evidence has exclusions for patients with kidney disease. So the only way to look at that appropriately is to combine lots of different trials, and we've done that in the beta blockers collaboration. We've not only looked at those different trials, but we've made sure that they're double-blind, placebo-controlled trials, and also that we have individual patient data for them, which means that we can look at individual patients and combine them in order to come up with robust conclusions. So in this analysis, we looked, as I said, specifically in renal impairment. We looked at two groups, those with sinus rhythm and those with atrial fibrillation at baseline, because of our prior findings about the differences we see. So we've stratified those analyses, and our take-home messages are that beta blockers are effective for reducing mortality in patients with sinus rhythm who've got heart failure, regardless of their kidney disease. So in patients with moderate and moderately severe renal dysfunction, those patients get a good mortality benefit from these drugs. They don't have increase in their adverse events, so the adverse events are actually the same as they were with placebo, which is a very important thing to tell your patients, and they don't change or impair renal function over time. We didn't see any direct benefit from beta blockers in those with atrial fibrillation, but again, these drugs are safe. They don't have any changes in their adverse impacts, and so it's a good point to make to patients that these drugs are effective in what they do.